We are now in conversation with Dr. Angelique Coetzee, who's a former South African Medical Association chairperson and primary healthcare physician. A very good evening to you, Dr. Coetzee. Thank you so much for your time. This is a matter that has left parents frustrated and anxious. What should we make of such a shortage?
Well, it's very unfortunate that there are shortages currently, especially with the tetanus and the reduced strength diphthery and acellular pertussis. We call it, the abbreviation is TDAP. So we have seen since 2022 that there's an increase, especially in pertussis, that is the whooping cough. And we need to use these vaccines from the age, especially from the age of 6, and then with a booster at 12. And also, if you are pregnant in your last trimester, that's also very important for those pregnant women to be vaccinated against tetanus, diphthery, and pertussis. So we should not have these type of shortages. Also remember that's part of the immunization program in the earlier years as well. So it's not only from the age of 6 and 12, but earlier, just after birth, we start with these programs where we need to vaccinate these children. So we should not have these vaccines. As I've said, we still see tetanus in South Africa, diphthery is still around, and as well as pertussis. Also remember, all three of these diseases is notifiable diseases. And, we can see an increase. We are going into winter again. So pertussis might be a problem. It's especially in the young children under the age of 1 year. It is of concern for us.
In layman's terms, how dangerous are these diseases, and how do they affect the system?
So tetanus, just to be to give a bit of background, it's both of all three of these diseases are actually bacterial infections, and we see especially tetanus in young babies, after the umbilical cords being cut, especially in the rural areas where they will use cow dung put onto the onto the umbilicus area, and those babies can get quite sick. Unfortunately, the mortality rate, or the rate of for you to die or for the baby to succumb, is quite high. So we need to look at that. And remember, we also need a lot of tetanus vaccines. If you are working out in the field or after the age of 12, we would recommend boosters every 5 to 10 years for people, especially working in the field or where they can get hurt or with animals or any of those kinds. So we need the tetanus vaccines. Again, there is no treatment for tetanus. If you get tetanus, it might again cause death. Another very common word for tetanus is that lockjaw, where the jaw is locked, the powerful muscle contractions, and that. So that's on behalf of the tetanus. If we then look at what we call diphthery, that is an infection in the throat. Those children can get extremely sick. And if you look in the mouth, you will see these white mucous membranes. It's spread by airborne droplets, toxins that is being produced, especially for the unvaccinated child. They get these very big, thick bull neck, fever, chills, fatigue, and they can die again. They die from that. And then the favorite pertussis that I've already mentioned, the whooping cough, that child will cough for about 3 months. There's very little that we can do. And our young infants under the age of 2 months are most at risk for these complications arising with pertussis, and they can also die. So we also have very high rates of hospitalization under these children. So we need to treat these. We cannot just ignore it.
With immunization being an important and effective health intervention, and the focus primarily at this point being around the vaccination for 6-year-olds, what would happen in this instance that they skip these vaccinations and the shortage runs for much longer? Is there a catch-up program of some sort? Because a lot of the parents that SABC News has been speaking to have said that it's a constant thing. They get there, they get half the vaccinations, they don't get the other half. One young mother was saying that she only got one vaccination as opposed to the many put out on that card. Is there a catch-up program?
There should be a catch-up program, but it's extremely difficult to get the mothers and the children back into the clinics for the vaccination schedules. We have seen again during COVID, there was a trend of mothers not taking the children to the clinics for the immunization programs on the cards, that the road to health type of map that they get. And again, it's leading to diseases. And we're going into winter time. Pertussis will be a problem coming up if you've not been vaccinated. Measles can be a problem. Rubella can be a problem, especially if you're a young, falling pregnant, never had been exposed to rubella, never had your vaccine, and you get pregnant and you get severe rubella that might affect the unborn child, and you might then abort the baby in the end of the day. So yes, it has really dire consequences. You should not, leave children and not get, for them not to get the immunizations. Also remember, where there's poverty, your immune system goes down. Then if you get measles, for argument's sake, you haven't got your measles vaccine, you get measles kill children. It's unfortunately not your friend. And if they're poor circumstances, poor nutrition, poor hygiene, that child is at higher risk of when they contract measles or any of these other preventable diseases. They might die. In hospitalization, we know how bad our situation currently is in most of the public sector hospitals. Yeah. So it is just a problem. Yeah. We cannot have this.
Yeah, we saw the outbreak of measles in 2022. But very lastly, Dr. Coetzee, do you think that this could be an isolated case, just a situation that the Northwest is specifically dealing with, or should there be concerns that other parts of the country may possibly experience the same shortage?
There should be a concern that other parts of the country might have it. Maybe they have not yet reported on it. Also remember, a lot of these vaccines is cold chain vaccines, so they need to kept cold. So if you break that chain and there's a shortage of these vaccines, there's nothing you can do. You have to throw those vaccines away. Currently, there's also, it's not compulsory in South Africa, but we have seen now in the cholera outbreak in Zimbabwe, and there's a dire shortage of cholera vaccines. So, you don't want someone to get cholera, having pertussis or having measles or any of these preventative type of childhood diseases that is actually preventable just because of stock out, whether it's a problem at the depot, whether it's a problem bringing it into the country. We should plan much better. And then we need to go out there and alert the communities, alert the doctors, have better communication with the communities and trying to warn them what to do to take care and try to isolate the children or people who then contract, let's say, pertussis or measles or any of those diseases. We need to communicate much better.